Hello, everyone, and good afternoon. Before anything else, I would like to introduce myself. I'm Sheenly Sorbito. I am a graduate of Bachelor of Science in Nursing in Riverside College, Bacolod City, Negros Occidental. I am a registered nurse by profession and presently working as an interventional nurse in Security Forces Hospital here in Riyadh, Saudi Arabia. I am an OFW for 7 years. I am a financial educator and financial literacy advocate. I am a property consultant in one of the best real estate developer in the Philippines. And now I am a senior marketing director here in International Marketing Group. Okay? Gusto nyo ba magkaroon ng financial freedom or financial peace? Para sa inyo, anong ibig sabihin ng financial peace or financial freedom? Well, for me, ang financial freedom is having enough savings and investment or cash on hand na you can afford a kind of life you desire. Hindi lang para sa sarili mo, kundi pati sa mga mahal mo sa buhay. So, dito sa IMG, nagpapasalamat po talaga ako because tinuruan niya po ako na the only way kung paano natin ma-achieve yung financial peace and financial freedom. Paano? Just build your solid financial foundation. So dito po, i-discuss natin kung ano nga ba yung solid financial foundation. Meron pong 6 na steps para ma-build natin yung solid financial foundation. First one is increase your cash flow. So sa increased cash flow po, kailangan po natin is live below your income or reduce your expenses. So unahin po natin bilhin lang muna yung mga kailangan, iset aside muna yung mga wants. Goodbye muna Louis Vuitton bag or goodbye muna yung mga branded clothes, branded shoes, bagong gadgets. So unahin lang po kung ano muna yung nararapat. And then you can increase your cash flow through earn additional income during your spare time. Kasi po, di po ba we are bounded by our work ng 8 to 12 hours and then our sleeping time as an adult is 6 hours. So usually yung spare time natin is around 6 to 9 hours. So if you are fan of nasa FB ka lagi, so utilize your social media account na mag-post ka ng mga businesses mo. And let's say, if you are very good, masarap ka magluto, then magbenta ka ng pagkain. And marunong ka mag-pedicure, manicure, or mag-massage, maghanap ka ng client. Maghanap ka ng ekstrang pagkakakitaan. So me, I am a nurse, so marunong po ako sa cannulations. So what I am doing is, aside sa IMG, meron po akong Glota business. At dito din po sa IMG, yung business platform kasi ni IMG, hindi lang po investment opportunity, kundi may business opportunity. So you can earn extra income as well. Pang-increase po yun ng cash flow po natin. Number 2 po is healthcare protection. So kailangan po natin is protektahan yung sarili natin. You are the breadwinner, ikaw po yung money machine, ikaw po yung kumikita, ikaw po yung nagtatrabaho. So you have to love yourself. Mahalin po natin yung sarili natin. Dapat po meron tayong short-term healthcare at long-term healthcare. Sa ngayon po, we are still in the productive stage. Nagtatrabaho po tayo. So covered po tayo ng mga healthcare na binibigay ng company po natin or ng institution kung saan tayo nagtatrabaho. But since yung problema, if you resign or if you retired, yung HMO na card na hawak nyo ngayon is remembrance na lang yun at zero ang laman noon. So you need a long-term healthcare na may magpo-provide ng pangangailangan mo sa medical once you retire at even you are beyond 60 years old. Kasi po, during the retirement period, doon na po lumalabas yung mga sakit natin. Kasi 'di ba yung katawan natin, hindi naman pabata ng pabata. Ang katawan natin, yung health natin is also declining or deteriorating. And take note po, number 1 reason ng Filipino bankruptcy is medical expenses. At yung bed po, yung pinakamahal na bed, hindi po nasa hotel, kundi nasa hospital. Imagine, ma-admit ka sa ICU, approximately yung room rate is 3,000 to 5,000, and let's say nasa critical stage ka and you need respiratory assistance, like you need bubag, you need ventilator, so may rental fee pa iyon. At the same time, kailangan pa nila i-monitor ka, so magbabayad ka din ng rental fee noon. So healthcare is really important para po sa ating lahat. So we need to prioritize our healthcare po. Next is life insurance protection. So importante po, if mahal natin yung family po natin, yung life insurance ay hindi po para sa atin, kundi para yan po sa mga mahal natin sa buhay. Kasi po hindi natin alam kung hanggang kailan yung lifespan po natin. Yung iba nga 30 years old pa lang or less than 30 years old, namatay na dahil may sakit pala sa puso or hindi mo alam, nag-cardiac arrest na pala. So you need to have an income replacement para once mawala tayo, may maiiwan po tayo sa family natin. Di po ba once na kumuha ka ng life insurance, yung policy mo is itatago mo sa kahon, and then once na namatay ka, yan naman po yung ilalabas mo. At ikaw naman po ang ilalagay sa kahon. So yan po yung life insurance, replacement po yun. May maiiwan ka sa family mo at hindi mababago yung lifestyle nila. So sa 10 years ba, hindi pa sila makapag-prepare ng mawala ka? Siyempre, 10 years, they can prepare na para din sa sarili nila. Hindi ka kasi magre-rest in peace kung alam mo na yung family mo or yung mga anak mo is wala palang pambayad sa tuition fees, wala palang pang school, wala palang pagkain, di ba? So, life insurance is really important. So, we have to protect our family through getting a life insurance protection. Next is manage debt or reduce liability. So, dalawa po kasi ang klase ng utang. May good debt saka bad debt. So, dito po, kailangan natin i-manage yung bad debt. Ano nga ba yung good debt? Ano nga ba yung bad debt? So, yung good debt po, let's say, nag-loan ka sa bangko and the bank is getting 5 to 6 interest rate per annum. So, yung pera na yon na ni-loan mo is in-invest mo siya sa isang business opportunity or investment opportunity or any investment vehicle na magbibigay sa iyo ng 10 to 12% interest rate per annum. So, winner ka. Meaning, nasa win-win situations ka, kumita ka. But, yung niloan mo sa bangko, tapos ginamit mo lang sa pamporma, panggala, pang-travel, at nadadagdagan pa yung liabilities mo, it is really a bad debt. And credit card is a bad debt pag hindi ka marunong gumamit. Imagine, credit card is getting you 3.5% interest per month. So in 1 year, 42% yung interest rate per annum, yung kinukuha na interest rate ni credit card sa iyo. So pag hindi ka marunong gumamit ng credit card, you have to manage it. Okay, next is have an emergency fund. The primary purpose po ng emergency fund is protection mo yun sa investments mo. Kasi let's say may nangyaring death in life situations na kailangan mo ng fund para doon. Let's say nawalan ka ng trabaho, may mahugot ka pambayad sa mga liabilities mo or may pang-provide ka sa mga needs mo sa buhay like pagkain, bahay mo, renta ng bahay mo at kung ano-ano pa. So dito po sa emergency fund, kailangan meron kang savings na let's say if you are single, 3 months ng expenses mo. Or if you are already married, 6 months ng expenses mo. So let's say yung gastos mo per month is worth 100,000. So times 3 mo yun, you need 300,000 emergency fund. And then if you are having a family and then yung expenses nyo is worth 100,000 per month, so times 6 mo yun. So you need 600,000 emergency fund. At ang sabi ko po kanina, emergency fund is protection mo yun sa investment mo. Kasi number 1, if may nangyari ngang yung financial crisis, most likely ibebenta mo si investment mo. So investment pa ba ang tawag nun? Kasi usually ibebenta natin sa napakaluging halaga kasi nagmamadali ka na, di ba? So hindi na talaga investment ang tawag doon. Next is build up savings and investments. For now, meron tayong kita. Nasa productive period po tayo. We are still earning. So as much as possible, we need to acquire more assets and more investment. Kasi para yun sa'yo. Para yun sa pag nawalan ka ng trabaho, merong may magpo-provide ng pangangailangan mo. Meron kang passive income to sustain yung mga pangangailangan mo, including health na din. And at the same time, di ba napakaganda? habang ikay nasa retirement stage na, nagta-travel-travel ka na lang at nag-i-enjoy ng life. 'Di ba? Tama po? So here, our lecture, we will be focusing on Kaiser Ultimate Health Builder Plan. This is the only long-term healthcare na available sa Philippines. So this is considered as the complete financial plan. Bakit? Because it will answer the 3 financial needs ng buhay natin. Number 1, meron siyang 3 features. May healthcare, someone to take care of you when you get old. Meron na siyang life insurance to protect your family if you die too soon. And lastly, meron po siyang investment and savings. So dito po, sa ngayon kasi, ang daming mga Pilipino na nagre-retire ng pensyon or ipon during the productive period ay napupunta lamang sa mga medical expenses post-retirement. So kailangan meron po tayong healthcare program na may magko-cover sa atin even we are beyond 60 years old. Kasi ito yung time na most of us get sick. So si Kaiser po is the first name in healthcare far more than HMO. Ito po yung ating brand ambassador, si Ms. Sharon Coneta Pangilinan. And then si Kaiser po, it's duly accredited with the IC or Insurance Commission. Before, it was under sa Department of Health or DOH. But since it is highly regulated financial industry, it is now under the Insurance Commission. It is also registered with the SEC or Security Exchange Commission on June 8, 2004 as a healthcare provider with an authorized capital stock of 160 million. So which is more than triple than the 50 million minimum required by the SEC sa mga HMO companies. So si Kaiser po is currently led by the President and the Medical Director of Director na si Dr. Leah Oyulo. She was the former Senior Vice President of the Medicare Health System Incorporated for 8 years. And she's also a former professor of the Faculty of Pharmacy, Medical Technology, and Biochemistry in University of Santo Tomas, Manila. At siya din po ay residency trainer by the Department of Pediatric of the Memorial Medical Center sa Quezon City. So here, I make an outline para po mas mabilis niyong maintindihan at maunawaan si Kaiser. And for me, it's easy for me to discuss na din po. So here we have the accumulation period na clear po sa contract natin na 7 years lang po tayong magbabayad. And then the extended period from 7th year to 20th year. So 13 years po magmamature yung policy po natin. And then next period is the long-term care period. Dito nyo na po ma-appreciate yung investment nyo po sa Kaiser. And other informations, yung mahalagang informasyon na kailangan nyo po malaman. Okay, first part is the accumulation period. So sabi ko nga, this is the period kung saan tayo ay nagbabayad at clear po kasi sa contract natin na tayo ay magbabayad lang ng 7 years. So dito po sa illustration na ito, you can see the average plan na plan K100. So anyway, ang pinakamababang plan is plan K45 at ang pinakamataas na plan is plan K1 million. So here is the average plan, plan K100. Modal membership fee if you are planning to pay annual. So 58,821.43 times 7 mo will be the total contract price. The total contract price is 411,750. So yung mode of payment natin, marami po tayong mapagpipilian. Pwede po siya monthly, quarterly, semi-annual, annual, and spot cash. So here pa lang, during nagbabayad tayo, this client started his policy at the age of 22 years old. So matatapos yung pagbabayad niya at the age of 29 years old. So dito pa lang during the accumulation period or the paying period, meron na po tayong makukuhang benefits dito po sa box na to. Okay, so we will discuss it one by one kung ano po yung mga benefits na makukuha po natin. Number 1 is the annual physical examinations. Meaning libre po dito yung consultation sa mga doktor and if you want to do a physical examination. And then entitled po kayo sa free diagnostic study like X-ray, free laboratories like CBC with platelet, urinalysis, fecalysis, or stool exam. And for policy holder na 35 years old and above, free po yung ECG. If below 35, kailangan na po ng prescriptions ng doktor. But if you are female and then you need a pap smear and mammogram, libre lang din po yun. Basta as long as you are 35 years old. But if below 35 years old, need lang din po natin yung doctor's prescription. And then, isa sa pang benefits din natin, number 2 benefits during the accumulation period is the dental benefits. So we have here the unlimited dental checkup, unlimited simple tooth extraction. Simple tooth extractions lang po kasi po pag major, hindi na po siya included. Once a year free dental prophylaxis, meaning libre po yung cleaning once a year. And then recementations of jacket, crowns, inlays, or onlays. Take note po, recementations lang po. Hindi po yung the jacket itself, the crown itself, inlays or onlays, at hindi din po included yung mga braces. And then included po, free po yung minor adjustments sa dentures. Next na benefit sa accumulation period is the basic health benefit. So let's say if you need consultation sa mga specialist or mga consultants like neurologists, anesthesiologists, surgeons, libre po siya. And also, if kailangan mo ma-admit sa operating room and at the same time sa ICU, libre po siya. Depende po kasi sa plan na kinuha nyo. Okay, next sa benefit po natin, benefit number 4, member's choice of room and board up to 1,000 pesos per day para sa plan K100. So let's say gusto mo ma-admit sa executive or sa VIP and it ranging yung per day ng room na yon is worth 2,000 to 3,000. So i-cover nyo na po ang exceeding sa 1,000. So i-cover nyo na po siya. And then number 5 benefit, yearly medical benefit limit up to 60,000 per year after full payment of the first year of the total premium. So depende din po sa plan. So dito po sa plan K100, you are entitled of 60,000 na medical benefit limit. So consumable po 'yan. Once nag-exceed, ikaw na po magbabayad. Once yung medical expenses mo is more than 60, ikaw na po magko-cover. So sa mga plan K45 or to plan 60, yung benefit limit nila is around 50,000. So paki-note na lang po, the above provision 1, 2, and 3 can be availed of the after full payment of the first year of the total premium. But if you are an OFW, yung sinabi ko kanina na dental benefit saka physical examinations is once na-approve yung policy mo, agad-agad you are entitled for that. So let's say ngayong araw na-approve yung policy mo and umuwi ka ng Pilipinas, nagbakasyon ka and you want to do a dental benefits, i-avail mo dental benefits and physical exams, libre po iyon. Okay, next is term life insurance coverage for 20 years. So meaning, pag namatay si policy holder, meron po siyang makukuha yung family po niya na term life insurance. So, yung coverage po dito, if yung cause of death mo is like mga normal diseases lang, so it can cover you up to 450,000 na life insurance coverage. So may makukuha ng family mo is 450,000. But if the cause of death is accident, madodoble po yun, times 2 po yun. So 450,000 times 2, ang makukuha ng family mo is worth 900,000 po. So here, during the accumulation period, you can also have an accidental death and dismemberment. So meaning, meron po kang makukuha na life insurance coverage din po. Let's say na ikaw po ay nawalan ng 2 kamay, nawalan ng paa, loss of 1 hand in sight of 1 eye, loss of 1 foot in sight of 1 eye, loss of both sides, covered ka po ng worth 100,000, worth of 100% na accidental death and dismemberment. Okay, so next is you can have a waiver of membership fees due to total permanent disability. So let's say na aksidente po kayo and then you're just paying, nagbayad ka lang po ng around mga 2 to 3 years and then nagkaroon po kayo ng permanent disability. So wala na po kayong capacity to work, capacity to pay po ng policy mo, considered na po siya at mawi-waive na po siya. Okay, so next is waiver of membership fees due to death. So let's say, habang nagbabayad ka pa lang, let's say 2 years or 3 years tapos namatay si policy holder, considered as bayad na po yung mga remaining na years na hindi ka pa nakapagbayad. And then, pwede mo rin po siya magamit as part of the benefits during the accumulation period. Kaiser is very kind enough para po gamitin siya as family assistant services. Considering na yung policy mo should be active status and plan should have completed at least 1 year na payment. And then, nominated patient must be an immediate family member of the policyholder or within the first degree of consanguinity. Then the policyholder agrees to avail only of the services of Kaiser's accredited doctors and affiliated network of hospital. Then assistance to be produced by Kaiser shall only be to the extent of the allowable benefits due to the plan holder under his policy. And then prior to discharge of the nominated patient, payment should have been settled to Kaiser. So Kaiser's approval to avail of such assistance must first be obtained by the member, and the issuance of LOA will then be given. So although po yung yung Kaiser is personal, but it can be used as collateral or it can be used as family assistance services, but subject pa po yun ng approval ni Kaiser. So the summary, during the accumulation period, yung mga benefits natin makukuha is total of 10 benefits. Included yung annual physical examinations, dental benefit, basic health benefits, members of choice home room and board, yearly medical benefit, term life insurance coverage, accidental death and dismemberment, waiver of membership fees due to death, waiver of membership fees due to total and permanent disability, and you can have it as a family assistance service. Okay, so now we will proceed to the extended healthcare coverage period. So dito po, from the 7th year to 28th year or to the maturity period. So ano-ano po yung mga benefits na makukuha natin during the extended period? Number 1 is long-term care benefit value, yearly healthcare hospital benefit limit, long-term healthcare experience incentive hospital benefit limit, lifetime network access, cost-free health benefit, and additional yearly healthcare hospital benefit. Okay, so let's do this one by one. Number 1 is the yearly healthcare hospital benefit limit. 10% of the long-term care benefit value earned starting from the end of the accumulation period and every year thereafter up to 20th year. So at 8th year po, meron po tayong makukuha na worth na 10,000 pesos. 10% po yon ng pangalan ng plan natin. Marami pong nagtatanong, bakit po 10% lang ng plan, hindi po 10% ng total contract price po na binayaran natin? Again po, imagine during the accumulation period pa lang 10 na yung benefits na nakukuha natin. And Kaiser is really designed po and it planned well. And at the same time po, kung ibibigay niyo sa atin ang 10% ng total contract price, it's really too aggressive. Baka naman po malugi or mawendang yung company po natin. So 10% lang po ng plan. At hindi po siya kagaya ng ibang short-term healthcare. Kasi po si Kaiser, it's really designed for a long-term healthcare. Kasi po yung short-term healthcare, it's really designed po for immediate consumption. Kaya hindi po siya pwede i-compare sa other na HMO. So from 8th year to 20th year, meron ka pong 10,000. So 10,000 times 13, total of 130,000. But hindi lang po siya naka-fix sa 130,000 because yung health benefit mo po, it's nag-accumulate or nagko-compound. So here, 10,000 po ang makukuha mo from 8th year plus 10% ng 10,000 is 1,000 plus the 10,000 ng ika-9th year, so total of 21,000. So 21,000 plus yung 10% ng 21,000 plus 10,000 ulit from 10 sa ika-10th year, so magiging 33,100 and so on and so forth. Until na yung makukuha mo sa accumulated health benefit mo is 269,750 at hindi po 130,000. Next benefit po natin is the additional yearly healthcare hospital benefit. It is a benefit other than the yearly healthcare benefit limit at the end of the accumulation period. And every year thereafter up to the 20th contract year, provided that the Kaiser's investment earnings is higher than 6% per annum. So, dito na po pumapasok yung investment. So, dito na po yung pera natin na ininvest sa Kaiser, ilalagay niya na po sa mga mutual fund companies. So, the mutual fund is giving us 6% to 12% interest rate per annum. So, for the sake of computations, ibibigay natin, or for the sake of computations, here binigay ni Kaiser is yung average na earnings na 8%. So 8% ng 411,750 is 32,981. Sabi nga kanina, provided that the Kaiser investment earning is higher than 6% per annum, magdadagdag po sa atin si Kaiser ng 3% po ng total contract price po natin sa ating yearly health bonus. So 3% ng 400,750 is 11,793. Ibibigay niya sa ika-9th year. So, hindi mo pa rin nagamit si policy mo dahil healthy ka. So, ika-10th year, bibigyan ka niya ulit because your Kaiser is kumita na naman po, yung mutual fund investments nila is kumita na naman po higher than 6% per annum, bibigay niya po ulit sa iyo. Yung bibigyan ka ulit niya ng 3% ng 400,750. Yan po yung 12,100 na nandito po sa illustration. So, here, aside po doon, nag-accumulate din po yung health bonus po natin. So here, the 8% po ng 411,750 plus may 10% po plus yung 3% ng 411,000. So that's why yung makukuha mo is 48,072. So 48,072 from 9th year, meron po additional na 10% nito plus yung 3% ng 411,750 kasi kumita po ulit ng higher than 6% per annum. So makukuha mo, it's 64,980. So upon maturity, yung investment mo doon sa Kaiser, approximately yung makukuha mo is 446,419. So pwede pa po siya aakyat dito kasi po fluctuating po kasi yung sa market. Okay? So next benefit is the long-term care benefit value. So guaranteed health benefit as shown in the schedule of benefit, which can be used at the end of the 20th year as part of the hospital benefit limit. So kung ano yung pangalan ng plan mo, so let's say plan K100, yung makukuha mo is guaranteed po. Ganun din po. So here, plan K 100,000. So here, ang nakuha niya sa long-term care benefit niya upon maturity is also 100,000. So kung yung plan mo is plan K 60, so 60,000 din po yung malalagay dito. Okay, next po sa benefit natin during the extended period, we can have a long-term healthcare experience incentive hospital benefit limit. So ito po yung tinatawag na money back. Approximately 85% of the total membership fees which can be converted into cash or be part of the hospital benefit limit from the 20th year until fully utilized. So imagine, ito po yung kaibahan niya sa ibang HMO. Kasi po pag hindi mo siya na-utilize or hindi mo siya nagamit within paying period or during the accumulation period, ibabalik ni Kaiser yung 85% ng total contract price mo. So 85% ng 411,750 is 350,000. But take note po, once na nagamit nyo po yung policy nyo during the paying period, ito din po automatic yung mawawala po sa inyo. Let's say, na-hospital po kayo, na-admit po kayo, and yung Kaiser po, nagbayad lang po ng worth 60,000, automatic, yan din po yung mawawala po sa inyo. Okay, benefit. Pag nag-mature po yung policy natin, during 20th year, approximately, yung capital po natin is 411,750 lang. Yung makukuha po natin, total maturity value is more than 1.1 million. So, dito po, aside po doon sa mga benefit na na-mention ko, may mga additional benefits pa po during the extended period. So here, covered na po yung outpatient benefit. So let's say masakit yung ulo mo and you need to see a doctor, covered na po siya. And then, inpatient benefit, once na-hospitalize ka, covered din po. Then, pre-existing diseases like meron kang hypertension, meron kang diabetes, mako-cover na din po. Then, covered na din po yung dreaded illnesses. I-mention ko po later kung ano po yung mga dreaded illnesses. And then, covered na din po yung maternity benefit. Yung may tanong lagi, bakit hindi po included yung maternity benefit during the accumulation period? Take note po ha, kasi po yung maternity or pagbubuntis, hindi po ito emergency. Ito po ay pinagpaplanuhan. So dito din po sa extended period, meron pa rin po tayong dental benefit and annual health benefit plus the additional health benefit. So, okay. So, ano po yung mga pre-existing medical condition? Pre-existing medical condition is those illness, injuries considered to be in existence prior to the effective date of contract. So, yung iba na kliyente po or ng policy holder is meron po siya, like example, meron po siyang hypertension or meron po siyang diabetes. Mataas po yung sugar, mataas po yung blood pressure. So, yung pre-existing medical condition is any professional advice or treatment was given for such illness or condition. Let's say po, may maintenance kang iniinom araw-araw. For diabetes, meron kang maintenance na metformin or glucophage. At kung hypertensive ka naman po, meron kang mga gamot na beta blockers. And then, such illness or condition was in any way evident to the member before the effective date of the contract. And pre-existing disease is the pathogenesis of such illness or condition started whether or not the member is aware of it. Okay, so the following illnesses will be covered during the extended period. Yan po yung may mga problemas respiratory like bronchial asthma, PTB or pulmonary tuberculosis, COPD, or diabetes, thyroid diseases, systemic allergies, hernias, DUB, chronic hemorrhoids, gastric or duodenal ulcers, liver cirrhosis, kidney diseases, blood dyscrasia, immunologic and collagen diseases, endometriosis, cholecystitis, hallux valgus, lithiasis, cancer, atherosclerosis, CVD, and CVA. Ano naman po yung mga dreaded diseases? Dreaded diseases po ay yung maapektuhan talaga yung buhay mo. And ang pagpapatreat po nito, yung treatment nito is really costly. So ano-ano po yun? Like cerebral vascular accident or yung stroke, cardiovascular diseases, coronary, valvular, hypertensive heart disease, cardiomyopathy, diabetes mellitus and its complications. Kasi pag meron kang diabetes, most likely yung mga complications napakadami. Hindi lang po yung kidney problem, kundi po meron na po kayong hypertensions and heart problem as well. And then central nervous system lesions, meron po kayong mass tumor or mga kung ano-ano dyan na cancer, liver parenchyma or disease, hepatitis, chronic obstructive pulmonary disease, COPD din, chronic kidney or urological disease, chronic gastrointestinal tract disease, and many more. Okay, so here the summary of the extended period, yung mga benefit na makukuha natin during the 8 to 20th year. So here the annual health benefit, outpatient benefit, makakover niya siya, inpatient benefit, pre-existing illnesses, dreaded illnesses, maternity benefit, dental benefit, annual benefit, plus the additional health benefit. At meron po tayong long-term care benefit, long-term care bonus, and additional health benefit. So once nag-mature yung policy mo, you will be given 3 options. So it's up to you kung ano yung plano mo after na mag-mature yung policy mo. So first is withdraw the entire maturity. So once na withdraw mo yung entire na maturity value, so meaning tapos na din po yung relationship yun ni Kaiser. wala na po kayong kontrata ni Kaiser. So number 2 option is withdraw only a portion of the maturity value. So let's say you're planning to withdraw worth 300,000. So the remaining po na more than 800,000, yan po yung i-repose or i-reinvest ulit ni Kaiser. So lastly is you can retain the maturity value with Kaiser, meaning po stay put lang. So dahil nga nasa productive stage ka pa, kaya nga kanina 'di ba, the client started this investment at age of 22. So, nag-mature yung policy niya, 42 years old pa lang siya. So, may capacity pa siya to earn at covered pa siya ng HMO ng company niya. So, inayaan niya lang po yung pera niya sa Kaiser. So, kung ano po yung natitira, kung magkano po, kasi stay put siya, i-repose at reinvest po yun ni Kaiser. So, dito po sa long-term care period, dito nyo na po appreciate yung investment niyo po sa Kaiser. Okay, sa long-term care period, imagine ka, yung 1.1 mo, pag hinayaan mo lang siya until umabot ka ng 60 years old because you're healthy at hindi mo naman siya nagagamit. Yung 1.1 mo, magiging 6.4 million at the age of 60. And wala ka pa rin sakit, napaka-healthy mo talaga. Kasi ang ganda-ganda ng ginagawa mo sa lifestyle mo, wala ka pang stress, parang ganun. So, at the age of 65 years old, yung instead na 6.4, magiging 10.4 million. So, imagine, napakalaki ng pera mo later on. And then, again, once again, paulit-ulit po natin tinuturo ito, yung pag-build ng solid financial foundation. At si Kaiser po, again, considered as a complete financial plan kasi it answers our 3 major financial needs. Meron po siyang healthcare, meron pong income protection, may life insurance na, plus investment as well. Okay, so si Kaiser po, integrated po siya with PhilHealth. Once admitted, you will be advised to file your PhilHealth reimbursement form. The PhilHealth reimbursement due shall be deducted from the total hospital bill. Kaiser members without PhilHealth membership shall shoulder and pay the corresponding portion of the PhilHealth. So napaka-importante po na may PhilHealth po tayo. Kasi pag meron po tayong PhilHealth and once you were admitted, kung ano po yung dapat i-shoulder ni PhilHealth, siya muna. And that's the time na magti-take over si Kaiser kung ano po yung remaining na bayaran. But then, pag wala kang PhilHealth, and then na-admit ka, so ikaw mismo yung magko-cover ng babayaran ni PhilHealth. And doon na papasok si Kaiser. Okay, next. If payment is made after the grace period, the contract shall be considered lapse. However, the owner shall be given a grace period of 30 days or 1 month to pay the due installment. Benefits may be provided the member only after the due installment is paid. So let's say nagbabayad ka during 30th of the month, and then nagkaroon ka ng problema kasi na-delayed yung sweldo mo, so bibigyan ka ni Kaiser ng 30 days para mo masettle yon. Pag hindi mo siya na-settled within 30 days, considered it lapse. Mape-freeze lang po yung mga benefit mo sa Kaiser. And also, Kaiser is very, very kind enough. So let's say, nawalan ka ng trabaho at 1 year ka hindi nakapagbayad sa Kaiser, so bibigyan ka ng options, update and redate. So sa update po, member will pay the premiums due on all the missed months and surcharge of 1.5% per month or 18% per annum from the date of each unpaid installment. Update meaning po, bayaran nyo po lahat ng mga miss nyo ng buwan. So 1 year, so 12 months nyo pong babayaran plus may surcharge po siya na 1.5% per month. So 18% po siya per annum. And then sa redate naman po, member will only pay the premium for the month. So, but the maturity period will be moved. So bayaran mo lang po ng 1 month. Same din po, you have to have comply sa application form, reinstatement application form, at magbabayad ka din po ng worth na 300 pesos plus the 1 month premium. So, again po, si Kaiser, pag wala din po kayo pa rin capacity to pay, hintayin niya po talaga kayo hanggang 2 years bago po i-terminate yung contract po ninyo. So the member shall be considered a new applicant subject to pre-existing conditions and for the purposes of contestability of insurance coverage and to any other requirements for a new applicant for membership in effect of that day. Kaiser will cancel the contract without need of notice to the owner if he fails to. All reinstated plans shall be subjected to the new price. Okay, so here we also have healthcare value. The owner may surrender the contract for its cash value stated in the schedule of the benefit provided the plan is active for at least a year. So ito po yung hindi ko po talaga nire-recommend. So once na nag-start po kayo ng investment niyo sa Kaiser, kumuha na kayo ng Kaiser policy niyo, ituloy-tuloy niyo na po. And considered Kaiser ay isa po sa mga bills niyo monthly para po ma-oblige po kayo na magbayad po. Okay, so pwede bang i-transfer si Kaiser Ultimate Health Builder? It is transferable or it can be assigned? Yes po. The benefit under the Kaiser Ultimate Health Builder plan may be transferred or assigned by the member provided that during or his or her lifetime, the member appoints in writing the principal beneficiary who shall receive all remaining outstanding benefits under the said plan in the event of his or her death. However, the Kaiser Ultimate Health Builder Plan itself cannot be sold or assigned or transferred to any third party, nor payment of membership fee be assumed by the said third party. So kailangan po is within family member niyo lang po. What are the benefits that can be received by the principal beneficiary? Yearly healthcare benefit value, long-term care benefit value, long-term healthcare experience incentive, and additional health care hospital benefit limit provided that the investment earning of the company is higher than 6% per annum. And the above benefit can be utilized by the principal beneficiary for his or her own health or medical benefit. So, pwede po ba mag-upgrade ng plan or mode of payment? Pwede po siya. Plan can be upgraded within 30 days after its effectivity date. So, mag-fill up lang po ng amendment form, magbayad lang po ng processing fee na worth 300 pesos and payment of additional installment corresponding to updated na plan. Yung mode of payment naman po can be upgraded anytime after the completion of its respective cycle. If within 30 days after purchase, pwede po, just fill up the amendment form, payment of additional installment due to corresponding the amount of the updated mode of payment. If beyond 30 days naman po, mag-fill up ka lang po ng amendment form, magbayad lang po ng processing fee na worth 300,000 and computation of dues based on the desired mode of payment. So let's say monthly ka ngayon, then the following year gusto mo na magbayad ng annual, so pwede po siya. But downgrading of a plan in mode of payment is not allowed. So let's say plan K 100 ka and the following year gusto mo lang siya plan K 60 kasi nga hindi mo daw kaya bayaran, hindi po siya allowed. And pati po yung sa mode of payment. So ang mode of payment, nag-annual ka ngayon tapos gusto mo siya mag-monthly, hindi din po siya allowed. Okay, for the eligibility for 10 years old and 40 years old, pwede na po siyang kumuha ng Plan K45. Yan po yung pinakamababang plan. But 41 to 50 years old, pinakamababang plan para sa kanya is Plan K60 na yung monthly po is around 3,000 plus, 3,127. And for 51 years old to 60 years old, Plan K75 na yung monthly payment po is 4,412. Okay, so here, the future depends on what we do in the present, sabi ni Mahatma Gandhi. So ano po yung ginagawa nyo ngayon, yan din po yung magiging resulta sa future mo. So kung ginagawa nyo po ngayon, yung pag-reach ng goals nyo or pag-reach ng mga pangarap nyo po sa buhay, most probably sa future po, naabot nyo po siya or goal met po siya. Okay, that's all and thank you so much po.